I must say that in the past years, many molecules, small molecules, have overwhelmingly emerged in the treatment of myelofibrosis in association to JAK2 inhibitors. JAK2 inhibitors are made a history in myelofibrosis, since I must say that there has been before inhibitors and after inhibitors. The main problems with myeloproliferative diseases are related to the neoplastic proliferation of precursors and stem cells, especially in the megakaryocytic section. This neoplastic growth that is dysregulated by some driver mutations brings to symptoms and signs characteristic of those illnesses that are the clinical signs, fever, asthenia, pruritus and other, to splenomegaly, anemia and cytopenias. All of those together with the progression of the illness concur to the increase of myelofibrosis and can bring to transformation in a blastic phase, all concurring thus to a reduced overall survival. JAK inhibitors are the first drugs that could have some results on controlling symptoms and splenomegaly, that is has been a breakthrough during the treatment of this illness, but unfortunately approximately 50% of those patients have problems in maintaining a response or cannot enter to the use of the drugs because they are already cytopenic, or they respond for a short period of time. And so we need to find something different than JAK inhibition. Also because they don't impact too much on the overall survival. This means that we need some drug-modifying drug, some drug-modifying disease. That means that they can intervene on the mechanisms that can develop the disease and stop or revert it. So they could intervene also on overall survival. And all JAK inhibitors have a modest, if any, disease-modifying effect. That's why we started to look at other mechanisms other than the JAK-STAT that can concur with JAK-STAT to the development and the progression of the illnesses. There are many target points that have been identified: epigenetic, signal transduction, microenvironment, telomerase or MDM2, that is a protein that blocks the p53 activity. All those mechanisms have showed interesting results in myelofibrosis, since they can be often synergistic together with the use of the JAK inhibitors. And further, they show some improvement on fibrosis, meaning a reversion of what is the main problem with those illnesses, meaning the hyperproliferation of fibrotic cells and those manifestations. That's why it's so important to analyze and try to identify a subset of patients that can have a benefit by using those small drugs.